To do that, we also need to allow the nursing representative from government, decisional, or like educational, all the decision makers that could be represented as our nursing advantage to achieve this outcome. So that's the national level for the future of nursing of ION.
Thank you. Any questions?
It's very in-depth. You guys did a very good job.
Just in summary for this portion, would you again state your name so that we can remember?
Sure. My name is Evan Thomas.
And my name is Feng Shi.
My name is Kali Chop.
Thank you. All right. And now we'll go to the other side of the table, and we will have a presentation by the other group, the other part of the class. And we'll start by introducing yourselves.
I'm Amanda Munoz.
Jill McQueen.
Jessica Patterson. Robin.
Thank you. All right. Who's
So
first?
our portion is the Nevada Nursing, and we are going to go over the Nevada Action Coalition, which is the driving force behind the transformation of healthcare in our state. It is the extension of what our classmates talked about, the future of nursing on the national level. And today we're going to talk about the four main points here within the Nevada Action Coalition, and that is diversity, education, leadership, and interprofessional collaboration of care. The first one, diversity, is mainly focused on a goal of increasing minorities and men within the nursing field. The goal is to push minorities into the nursing field at a level and thanks at higher rates. So we have many minority students within the associate level, and we want to increase them up to BSN and further. And we also want to increase men within the nursing profession. Here I have a table, and it actually shows that men are in Nevada are at 8.4%, and women are at 91.6% within the RN population in Nevada, and then it compares it to the whole nation, which is men are at 6.6% and women are at 93.4%. So there's definitely a shortage of men in the field, and it's something that needs to be improved upon. So that's one of the goals of diversitizing the RN population. Another goal is to increase minorities within the nursing field, and in Nevada, I have a chart here that also shows the percentage of different minorities. We have African American, Native American or Hawaiian, white, Hispanic, Asian, and American Indian within the population. And the most prevalent is the white or the Caucasian at 72.6 or 72.2%, and then followed by Asian, which is at 16.6. So it's very important to push these other minorities into the nursing field so that we can better diversitize and give more competent cultural care to these patients. Because obviously if our population, which is this final chart, our population is very diverse, then we need to have a very diverse nursing field to cover all of our cultural backgrounds. One of the major pushes would be the Hispanic population within the RN field, and at this point it shows that 3.7% of our RNs are Hispanic, and it is the largest growing population within the state of Nevada, so it's very important to push them into the field so that we can better understand their culture. And then this final chart just shows within the population of our state the different percentages of ethnicities within Nevada. And if if you will have a chance, you can look at it. But it's helpful to understand and compare.
And I did education, and basically, with the passage of Bill 170, Nevada nurse practitioners were able to practice more autonomously without being under the watchful eye of a doctor. So they're now able to give complete care to their patient, from caring for them and prescribing medication, which makes it easier for patients, citizens of Nevada, to get taken care of, because before there was too many patients for the doctors, so we're waiting long time to see their doctor. And then another initiative is a BSN in 10, which basically is they're trying to, Nevada is trying to get people to complete their BSN within 10 years of completing their, of passing their RN. And Nevada realizes that they want to make education more seamless, so they are driving and pushing for more online education, being that people don't have the privilege of being able to quit their job and go to school full time. So that's going to help a lot with make education more seamless for Nevada. And then here I have a chart basically talking about the levels of degrees in Nevada, coming from a certificate to a diploma, an associate, a bachelor's, a master's, and a doctorate, compared to the United States.
So here I'm going to talk about the leadership in the Nevada Action Coalitions. The nursing field is ever expanding, and the future of healthcare can't be without nurses. When people look at nurses, they generally think that nurses is all about patient care. But however, Linda Pollock will emphasize that nurses are also leaders. They take the roles and set the foundation for tomorrow nursery care, the torch to continue the legacy. Linda Pollock and RNC and MPA and SIP coordinators state that the Nevada Action Coalition, abbreviation for NAC, is part of the Future of Nursing Campaign for Action. The NAC Executive Committee meets every month. The NAC is funded by the Robert Woods Johnson Foundation's grant. The organization also works in conjunction with the Institute of Medication, abbreviation IOM, Future of Nursing for Recommendation. They work together in conjunction so that they make recommendations for the IOM. So one of the two of the recommendations that the NAC made to the IOM is that they want to increase the number of BSN prepared nurses into the workforce. So they want to prepare the BSN graduates to better understand how the workforce is operated and help transition them into the workforce. The second recommendation is called the transition into practice for all new graduates and for the nurses who had not been in the workforce for a while. They want to help the nurse who was out of practice, so reorient them into the nursing field again. And the nursing, the leadership of the NAC is in the process of getting the 501c3 status, so that it can accept donation to create a Nevada Nursing Workforce Center. Unlike any other state, Nevada lacks a dedicated workforce center. The NAC aims to have its website active before the end of March of this year, 2015. The leadership workshop also continuously handle the state implementation grants, abbreviation for SIP, and they are deliverable so that the NAC can get the funding for the next month. Additionally, Ms. Pollock also mentioned that the NAC is multifunctional in that it's established infrastructure, collect data, standardize the RWJF Future of Nursing, and they found committees. And they speak to the medical facilities and the nursing organization about the foundation and the organization so they can have a coalition. And the leadership workshop work group also leads a Nevada Action Coalition, which is consisted of medical organization, business partners, state delegates, educations, and community organizations. Dana told me PhD and who's also an RN, JS and AC executive committee. So I will end my presentation and have Jessica present her.
So the last piece is about interprofessional care, and basically it is establishing that we as not just healthcare providers like nurses and physicians, physical therapy, etc., need to collaborate to improve the quality of care here in Nevada, but also collaborate with other stakeholders, which can be anything from just the hospital systems, community colleges, other nursing universities, legislators, minority nursing groups, the State Board of Nursing, unions, and any other or businesses in the general community. So basically, what this last part about interprofessional care is trying to do is just bring everyone together to improve the quality healthcare getting provided to the communities all throughout Nevada. And essentially, all of the diversity factors, the education, and the leadership all kind of come together in this way, because without trying to diversify the nursing population, we're not going to have as much collaboration, because we have such a diverse population. And if we can't get the extra cultural care seen from nurses or other healthcare providers that are of other ethnicities, then we won't get as much a better improvement to the actual healthcare system. And obviously education helps to improve everyone's standings as far as collaborating, and because everyone brings a different piece to the puzzle. And leadership, obviously we want to see an increase in the leadership of any of these different organizations or stakeholders that come into play that are trying to improve the entire system. So basically, the interprofessional care workforce group is focusing primarily on just their ultimate goal is to improve the higher quality care to as many people as possible, in combination with all these other points we've all made. And that's it.
Okay. Just in summary, what I'd like you to do is, this is a very unique group of students in that they are part of the ABSN program at Roseman University School of Health Sciences, School of Nursing, and each of these individuals have completed an undergraduate degree in some aspects of healthcare. And they're in the accelerated BSN program, where they've added an additional 15 months, and they will be graduating and become newly licensed registered nurses in the community. So Evan, would you tell us what your degree is in?
My first degree was in sociology.
Your second one?
My second one was in nursing, and I also got technical degrees in emergency medical services.
Okay. Penn?
My first degree is in traditional Chinese medicine back in Shanghai University, and my second degree is in Marymount University. I have the health science track for physical therapy, and I'm studying nursing degree right now, and then have my
Awesome.
third degree in nursing.
Absolutely awesome.
My first degree was in biology, and the second degree I'll be obtaining is in nursing.
My first degree is in biology, and I'm trying to get a second degree for nursing.
And my previous degree was in kinesiology, and I am currently trying to become a nurse, so it will be my second degree.
I have an Associates of Science, I have a Bachelor's in Psychology, and then I will have a BS in nursing.
Awesome.
My first degree is in psychology, and my second will be in nursing.
Well, thank each of you. Thank you so much for participating and making this a very educational experience. And we appreciate working with you, and I appreciate knowing all 7 of you. And I wish you the best as you continue.